So based on the recall questions which we got from the students, so we'll see that the questions, what type of questions were there and what are their probable answers, because some of the questions might you find that they are not exactly what they appear in your exam, because they are the memory based questions which we are discussing it here, came in your exams. So let's see. So first question: a young male with testicular lesion underwent high inguinal orchidectomy. The histology of the tumor is having the nesting pattern of tumors infiltrated by lymphocytes. The tumor cells were positive for OCT3-4. So what is the hint here in this question? First is the nesting pattern of tumor infiltrated by lymphocyte. That is a testicular tumor. So in itself, it's a very, very classical histology. So in our classes also, I told you it earlier also that if any tumor of the testis is having the characteristic histology of the nesting patterns of the tumor and infiltrated by the lymphocytes, like there are so many tumor cells here and there, and in between those tumor cells there are intersecting fibrous bands like these. Okay, and in these fibrous bands there is a presence of the lymphocyte like this. So it gives a very, very characteristic histological finding, even if you don't know that what is this OCT3-4. Okay, where we are going to use OCT3-4 in which tumor. Okay, so that's not the problem. Even by the histology you can identify the lesion that it's a very classical of seminoma, one of the most common tumor of the testis, that is seminoma, and in females in ovary it will be called as dysgerminoma. So both are the same tumors having the same histological finding and with the same tumor marker. So what will be the tumor marker? The tumor marker will be OCT3-4. Then there is LDH and PLAP, that is placental lactogen alkaline phosphatase. Okay, so it's in itself, it's a very characteristic histological finding is already given to you. Even if you don't know that what this marker is, even you can solve this question simply by focusing on the histological finding which is given here. Okay, so it is not fitting into the choriocarcinoma, it is not fitting into the embryonal carcinoma, it's not fitting into the teratoma. So the only answer which is fitting here is the seminoma. So the right answer will be seminoma, where you will see that there will be a tumor cells which are separated by the presence of the large fibrotic bands, and in those fibrotic bands the bands are infiltrated by the presence of numerous lymphocytes. And if you will apply the marker like OCT3-4, PLAP or LDH, they will come positive. For like teratoma, they will say you that there are the different type of morphology of cells are there. Like there are the epithelial cells, there are the mesenchymal cells, there are some cells which are derived from the endoderm, there are some cells which are derived from the ectoderm, there will be some cells which will be derived from the mesoderm. So when any tumor is having multiple different type of tumor histology derived from the different germinal cell layers like ectoderm, endoderm, and mesoderm, that tumor will be called as teratoma. So here they are not saying anything about that, so it will not be fitting into this condition. For choriocarcinoma, they will give you the finding like there is a presence of multinucleated giant cells, or multinucleated cells like syncytiotrophoblasts, like cells. Okay, will be given to you. So that is not given, so that is also ruled out. And just by one line, that is a tumor infiltrated by lymphocytes. So any tumor which is infiltrated by lymphocyte in testis or ovary will be considered as seminoma. So this is the question number 1. Let's see the next question. The question is, what gene is affected in Reiter syndrome? Okay, Reiter syndrome. So what is Reiter syndrome? You must know this. This is one of the example of seronegative arthritis. What are seronegative arthritis? Where there will be a negative for RA. Okay, which is negative for RA factor, and they all are the conditions which are positive for one HLA, that is called as HLA B27. So it's a very straightforward question, very straightforward answer. That is HLA B27. So actually it's not a gene. I think it must be a HLA. Okay, it should be like which HLA is associated with the Reiter syndrome, that is a seronegative arthritis. Like there are certain conditions which fall into the same category of seronegative arthritis. Like one of the condition is Reiter syndrome. Otherwise, other are ankylosing spondylitis, and psoriatic arthritis. Psoriatic arthritis, that is also one of the condition. Okay. So it's a very simple question. So answer will be the HLA B27. So what conditions are HLA B27 positive? Like Reiter syndrome, ankylosing spondylitis, and psoriatic arthritis. Next question, the question number 3, which I talked in my class also. I told you in this year class also that there will be a NEET in your NEET exam. Okay, so there should not be any problem. I also utter the same line in the class also, that now in this year there will be a question based on the NET. So what is NET? Neutrophil extracellular traps. Neutrophil extracellular traps. So these are the neutrophils which around the cells, even after the death of the neutrophil in acute inflammation, neutrophil used to lie in form of neutrophil extracellular traps. So these things which you can see here around the neutrophil, a meshwork of the fibrils around the neutrophils, those meshwork of the fibrils around the neutrophil is called as the neutrophil extracellular traps. And what is the importance of these traps? That they are a very good bactericidal things. So first of all, these fibrils will restrict microbe. Yes, this is right thing. Arginine is required. Yes, it is required. Can they do phagocytosis? Yes, they can do phagocytosis. What is not true? That it is associated with SLE. So there is nothing to do with SLE in these cases. Neutrophil extracellular tags are related with the neutrophil. After the death of the neutrophil in acute inflammation, neutrophil used to release around it traps that are called as neutrophil extracellular traps, or the fibrils, which are a bactericidal thing. Okay, and what is this neutrophil extracellular trap? In the class I told you that what are these neutrophil extracellular traps made up of? They are made up of the nuclear material of neutrophil. That I told you in the class, that this will be the question, that neutrophil extracellular trap are made up of, they consist of the nuclear material of the neutrophil. Great. Let's come to the next question. Again, I uttered this question in the class, that Philadelphia chromosome is caused by the translocation of. I told you in that class also that even if you want to remember only one translocation in whole medicine, whole pathology, then the translocation should be 922 translocation. Again and again, I uttered the same thing in your class, that always go with this translocation. This will be there in your exam. So I told you in the class that every one and another year you will get question based on two important translocation. One is 922 and second is 814 translocation. 922 translocation is also called as Philadelphia translocation, and this Philadelphia translocation is commonly seen in CML cases. It also seen in ALL cases. It also seen in CNL, chronic neutrophilic leukemia cases. So these are the three conditions where it can be seen: neutrophilic leukemia, acute lymphoblastic leukemia, and CML we all know, chronic myeloid leukemia. So chronic myeloid leukemia. So remember, this 922 is diagnostic of CML. Okay, but it could be seen in all these three conditions: CML, ALL, and CNL. But it is diagnostic only and only of the chronic myeloid leukemia. Like 1221. 1221 is also seen in ALL. Okay, 814 is seen in which condition? Burkitt's. So again and again, I told you the same thing in the exam or class also. So again, the same things will come in your exams every time. So these questions are not easy, but they are very, very important. Why? Because earlier there was no important test available for the CML. Just based on the peripheral blood findings and the bone marrow finding, it was difficult to differentiate CML from the rest of the other chronic leukemias. But now we are having 922 translocation that is very, very characteristic of the CML. Okay, so that's why it is very, very important. So 922 translocation of CML, 814 translocation of the Burkitt's, both are diagnostic of these conditions. So that's why I told you that always remember these two important translocations. So here also in the this year we got the question. Okay, the next question is quite easier thing. I think you all have got the right thing. A teenager was brought to the OPD with the complaints of the delayed puberty. Secondary sexual development is again abnormal here. Widely spaced nipples are there. Okay, so the answer is that it is 1 minute. मैं सेवर बंद करना. And this is a I think pretty easy question. Fifth number question. A teenager was brought to the OPD with the complaints of delayed puberty and abnormality in the secondary sexual development, widely spaced nipples, and on examinations he was diagnosed as Turner syndrome. Which chromosome is involved? I think it's a very, very easy thing. So you all know that there will be a 45XO. Okay, so there will be an absence of one X from the pair of 2x. Okay, so usually normally it should be 46XX if it is a female, but once the one chromosome is deleted here, then that female will have all those signs and symptoms related to the puberty, abnormal secondary sexual characters, widely spaced nipples, and there will be a cystic hygroma-like condition in the neck, and so many different other features. So I think it's a very simple question, no problem at all. The next question is related with the hematology, and it's again a very simple question. If you remember my class room teaching, then it is a very, very simple thing for you to solve. Okay, so a patient reports to the outpatient department with the complaints of the fatigue, and investigations reveals that there is a hemoglobin which is around 5.9. So it's a anemia. So I told you that hemoglobin, if it is less than 12 gram per deciliter, it should be considered as the anemia, but here the hemoglobin is quite low, so it should be considered as a severe anemia. So a patient is having a severe anemia. Then I told you that you have to see the indices, RBC indices, if they are given or not given. So RBC indices are not given here. Instead of that, one RBC indices is given, that is increase RDW. So based on RDW, we can differentiate two important conditions, like one is called as iron deficiency anemia from the thalassemia. Okay, so iron deficiency anemia can be differentiated from the thalassemia on the basis of the RDW. RDW tells us what? RDW means what is the degree of anisocytosis. Anisocytosis means the 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 variation in the size of the cells. Okay, so variation in the size of cells will be more in iron deficiency anemia as compared to the thalassemia. So that's why RDW will be more as compared to the thalassemia. Okay, so here increased RDW is given. Even if you forget that what is RDW, okay, and you are not able to correlate it with the anything, then there is no problem. Again, you have to see the iron parameters. Like here, the iron parameter is given is TIBC, total iron binding capacity, which is increased here. So if TIBC is increased and the ferritin is low or decreased, and I told you earlier also, if you remember my class teachings, that I told you that if ferritin is low, it is depicting that the iron stores are less. Okay, and if iron stores are less, that means it's a iron deficient condition. So this is fitting into iron deficiency anemia. Simple. If TIBC is increased, serum ferritin is low, serum iron is low, and RDW is increased, that means it's a case of iron deficiency anemia. So answer will be iron deficiency anemia. Okay. If they will say in the same question that iron parameters are normal, TIBC is normal, ferritin is normal, but RDW is remaining normal, then you will consider it as a case of thalassemia. But they are giving us the TIBC, which is increased here. So that is taking place in iron deficiency anemia cases. So I think it's again a simple thing, no problem at all. Next question is that a patient wants to give the blood, and the vacutainer that a lab personnel is having, that is capped with a gray color cap, gray color cap vacutainer. So I think they gave you the picture. Okay, and in the picture there was a vacutainer, and that vacutainer was capped with the gray color cap. Okay, so the gray color cap tells us what this tube is containing, what this vacutainer is containing, that is the fluoride. Okay, and that sample which is taken in those fluoride containing vacutainers, the test which we are going to apply on that blood will be the serum glucose levels. Okay, so please remember the gray capped vacutainers are used to collect the blood for estimation of the serum glucose levels. Okay, next thing, they can give you the heparin, which is a green color tubes. Green color capped tubes are containing heparin. Okay, lavender color containing lavender color capped tubes are containing EDTA, which is used for CBC, complete blood count. Okay, and routine all types of blood tests. Heparin is widely used for genetic testings. All the genetic testing we are using the heparinized blood. Okay, even for ABG, arterial blood gas analysis, we are using heparin containing blood. Sodium citrate vials are capped with the blue color capped vacutainers, and that is widely used for the coagulation studies. Coagulation studies, even for ESR estimation. So now you know that these things are very simple. Okay, so gray color cap tubes are used for estimation of serum glucose. Next question, most radio resistant phase of the cell cycle. It's again a very commonly repeated question. Very commonly repeated question. Okay, so radio resistant phase is phase S. Okay, and most radio sensitive phase, if they ask the radio sensitive, that will be the M phase. Okay, the mitotic phase, when the cells are going to divide, at that time the radiations are going to impact the cells. Okay, so more and more mitotically active cells, those are more radio sensitive. Okay, and the phase, the cells which are more and more in S phase, they are more and more radio resistant. Next question, again a very simple one. I think all of you have must seen these kind of clinical cases in your clinical rotations in your MBBS. That what a 25-year-old woman discovers a well-defined mobile rubbery breast lump. First of all, think the mobility is that the lump is quite easily mobile in the breast parenchyma. The the consistency is rubbery. It's not hard. It's not fixed. So if any tumor is hard, if any tumor is fixed, okay, so that will be more and more of malignant nature. And the tumor which are very easily mobile, they are rubbery in nature, they are soft nature in nature, so those are benign in nature. Okay, it is painless. Okay, stable over months means the growth of this tumor is quite slow. It's a slowly growing tumor, it's not a rapidly growing tumor. If the tumor is rapidly growing, if it is fixed to the skin or to the underlying tissue, that it will become malignant. If lymph nodes are enlarged, again it is going in favor of the malignant lesion. So it's a benign lesion. So by all the clinical picture, you can see this is a benign lesion. And in the breast, if any kind of mobile breast mass is there, most probably it would be a fibroadenoma. If you even if you don't remember, then there is no problem, because all the three other options are related to the malignancy. Okay, so intraductal papilloma of phylloid tumors. Phylloid tumors usually are large tumors. Okay, they are the leaf-like large tumors. Okay, invasive ductal carcinoma is a malignant lesion, so it would be hard, it would be fixed. Okay, DCIS are usually smaller lesions. Okay, they are very difficult to be palpated. Okay, so easily movable, mobile, rubbery breast mass is going in favor of the one of the most common benign breast lesion, that is fibroadenoma. Okay, it is also called as breast mouse, because it's moving like here and there in the breast parenchyma, just like a mouse. So it's a characteristic fibroadenoma. If they will give you the pudgy orange appearance, the tumor is attached to the superficial skin, or there is a puckering of the skin. Okay, if the lymph nodes are enlarged, those all features are going in favor of the malignant lesion. So I think it's a very straightforward question. It's a simple one. That's a fibroadenoma. The next question, question number 10. A 68-year-old lady present to OPD with the dementia and Parkinson. Like some students said that it's coming in this pattern, that the dementia was given and the Parkinsonism was given. Some students said that it is given in this form, that there is a 60-year-old woman present with resting tremors, bradykinesia, cogwheel rigidity, consistent with the diagnosis of the Parkinsonism, and then they ask the pathological lesion that is seen in the brain. So again, in the both of the patterns, in the both of the questions, I think it's a very straightforward question, that the condition is Parkinsonism, and they are asking about the pathological lesion in Parkinsonism. Okay, so that we all know that the presence of Lewy bodies are seen in these cases. So I think it's a very straightforward. Okay, Heinz bodies are not seen in the this brain lesion. It's seen in G6PD anemia. Okay, Negri bodies are seen in rabies condition. Amyloid bodies are seen in Alzheimer's. So only one thing is, you easily you can rule out all the other conditions. Then you will be having only one body left, that is the Lewy body. So Lewy body are characteristic of these cases, that is Parkinsonism. And the second condition where you can see the Lewy body is the Lewy body dementia. Okay, so if Lewy body dementia is given in the option, that will be the right answer. If only Parkinsonism is the given, then that will be again the right answer. So this is the Lewy body you can see here. These are the intracytoplasmic eosinophilic inclusions seen in the neurons in cases of the Parkinsonism. So some says that the options were like this: the Hirano bodies were given, neuritic plaques, neuritic fluid triangles were given. So all these three features are related to Alzheimer's. Only one was associated with the Parkinsonism, that is the Lewy body. Next question is again the question which I uttered in the class also, that there are presence of Flexner-Winterschner rosette. So when tumor cells arrange itself in a rose-like pattern, that is called as rosette pattern. And I told you in the class also what are the lesions which are having the rosette-like pattern. So in those cases, I told you the first and most important is retinoblastoma. And retinoblastoma is a lesion of the eye, or a tumor of the eye or the orbit. So that is having the rosette like formation in the tumor histology. That is very, very characteristic. So out of all these three options which are left here, they are not having any kind of rosette formation. So out of these three, or the rest of the three options, only one option which is having the rosette actually is the retinoblastoma. So any lesion which is containing the word blastoma, they are usually having the rosette formation. Just for easy to remember thing, that like retinoblastoma, medulloblastoma, pinealoblastoma, okay, so pituitary adenoma. So these are the lesions which are having the word blastoma, and they are having the one common feature, that is the presence of rosette formation. So I think it's clear again. Again, the same question, gray color vacuum thinner used for glucose is again the sodium fluoride containing vacuum thinners. The question 13 number question we have already discussed, that is the Parkinsonism having the what kind of pathological lesion, that is the Lewy body. So all these are the important questions that I talked in this session, and even most of these questions were from the earlier teachings in the classrooms and the miscellaneous handouts which I gave you during my sessions. So I think most of the questions are easy here, easy to be seen here, and easy to be solved here. Even if you're not knowing the exact point, but if you read the whole question very carefully, then you can make out there are certain hints which are given in every questions to solve the questions. So I hope you all had the nice session. So we'll again meet in the next session with the newer things, with the newer advancement in the pathology. Hope you all will be passed with the flying colors. Okay, and best of luck to everybody. Thank you. This is your pathology teacher, Dr. Tarun Sharma.